All right, good afternoon, everybody. I'm Tiffany Bradbury with Community Engagement, and I have with me, I have Mayor Lee, I have Vice Mayor Cobb, I have City Manager Bob Cowell, and I have a very special guest with us, Debbie Bonniewell from Blue Ridge Behavioral Health. So I am going to turn it over to Mayor Lee to get us started.
Thank you, Tiffany, and good afternoon again to everyone. Today's press conference will focus on staying strong in the face of the COVID-19 pandemic, how we can do this as a community, as families, and as individuals. In response to the pandemic, the city has supported our community by continuing to provide essential services during these days. Although offices are closed to the general public, the city continues to maintain public safety through E911, fire EMS, and police services, collect solid waste on its regular schedule, provide benefits and services to families through social services, accept tax payments by mail, drop box, online, and by phone, handle construction permit applications and transactions remotely, and more. So we've been busy. With the governor's announcement on Monday that Virginia will likely begin to reopen on May 15th, Roanoke has initiated its plan for recovery. This plan will guide our own reopening, as well as supporting the community as it gradually reopens. As a result, today we are announcing the release of Roanoke Star City Strong, Response, Recovery, and Resiliency. This is a framework for how we as a community progress from responding to COVID-19 to supporting our recovery. It will address the challenging economic impacts that resulted from COVID-19 and make us more resilient, giving us a path to regain the momentum we were experiencing. Based upon the governor's announcement, with the anticipated beginning of phase 1 of his plans for reopening Virginia on May 15th.
Have a sporting event back in NASCAR, which is right in our backyard.
That's on Zoom.
May the 17th.
You can watch it on Zoom, but I don't have any sound for it.
They would have a race on May the 17th, and then on the 20th, another race in Darlington. So they're going to have.
We will. Well, let me begin. Based on the governor's announcement, with the anticipated beginning of phase 1 of his plans for reopening Virginia on May 15th, we will similarly begin the phase reopening of municipal facilities, starting with our greenways. Provided the governor initiates phase 1, as indicated, on May 15th, the Garden City, Tinker Creek, and Lick Run greenways will once again be open through associated parking areas, even though those parking areas again be open through associated parking areas will remain closed. I'm sorry, those associated parking areas will remain closed. Then on Tuesday, May 19th, the Roanoke River Greenway will once again be open, though associate parking areas will remain closed. Wiley Drive will be closed temporarily to vehicle traffic along its entirety through Smith Park and from Franklin Road to Crystal Springs Avenue to further facilitate sufficient physical distancing. Greenway users are encouraged to wear face masks and are reminded of the need to maintain at least a 6-foot separation from one another, and to refrain from gathering in groups exceeding 10. Let me say that again. To refrain from gathering in groups exceeding 10 people. The city has established 4 staff working groups, each focused on some aspect of reopening, recovery, and including a particular emphasis on small businesses and our vulnerable population. Also, the city has collaborated with the Roanoke Regional Partnership to establish an economic advisory panel. This panel, made up of a diverse cross-section of business leaders in our community, will assist the city in understanding how our local economy is recovering and where challenges may remain. The city is establishing a recovery fund of at least $1 million using city funds, CDBG funds, and other sources to support recovery efforts in our community. These funds are in addition to the $43,000 previously provided through Virginia Career Works and the $75,000 collaboration with the Roanoke EDA and TAP announced today. Though we are beginning this process of phased reopening and recovery, it is critical to remember COVID-19 remains in our community. And unfortunately, people continue to die from its effects. So please understand that even though we're taking these actions here, but COVID-19 is still there and people are dying and we're still focusing on lives. We must remain vigilant and continue many of the practices we put in place that have kept most of us safe thus far. So I will now turn the press conference over to the Vice Mayor, Mr. Joe Cobb.
Thank you, Mayor Lee. In addition to the elements of the recovery framework just outlined by the mayor, each city council member will convene a virtual conversation with citizens to learn how they are preparing for recovery and the challenges they anticipate facing. These conversations will begin next week, and the findings will be shared with the entire council at an upcoming meeting. City Council is also forming a recovery task force chaired by the mayor and myself, with a diverse cross-section of community leaders who will assist us in determining the best way to use the recovery fund mentioned by the mayor. Our various boards and commissions have begun preparing for some form of limited meetings beginning in June or July. The city's framework also looks beyond response and recovery. It addresses ways to make ourselves as a community more resilient against similar crises in the future, and how we can regain the momentum we had just a few months ago. The theme of recovery and resilience is so important at the individual and household level, just as it is at the community level. Due to the impact of COVID-19, there are folks in our community who are grappling with difficult challenges, such as loss of employment, income, and routine. They are also experiencing anxiety associated with the physical separation necessitated by the governor's stay-at-home order. For that reason, the ability to care for our own mental health and that of others has never been more important. This is National Mental Health Awareness Month, and to give us some insight on what she is seeing in our community And to highlight the mental health resources available to you, our citizens, we've invited Debbie Bonniewell, Chief Executive Officer of Blue Ridge Behavioral Health, to our panel today. At this time, I'm honored to introduce Debbie to share her thoughts and observations with us. Welcome, Debbie.
Thank you very much, Vice Mayor Cobb, and thank you, Mayor Lee, and thank you to city staff for also inviting me to today's press conference. I would ask Tiffany if you don't mind putting up my PowerPoint. Probably the biggest message I want to make is that, you can go to the next slide, is that Blue Ridge Behavioral Health Care as your local public community mental health center is open. We have remained open throughout the pandemic. In mid-March, we, as soon as we received regulatory suspension of some difficult hurdles, we moved to telehealth within about 2 weeks for many, if not probably 90% of our services. However, we understand that there's many in the community that do not have access to either the electronic equipment or maybe don't even have a telephone or don't have Wi-Fi capability. So we are still open at our same-day access site at the Burrell Center at 611 McDowell Avenue Northwest. And we still have same-day access there Monday through Friday, 8:30 to 3 p.m. However, recognizing that is a lot of anxiety out in the community, we also have worked very hard to be able to figure out how to provide an initial assessment also by telehealth for people that might be reticent to come in person to our center. And so folks can also just call to start services at 540-343-3007. Our 24-hour crisis services continue. This is always our crisis line, and both of these numbers and this information is available at our website at www.brbh.org. So just to stop for a minute and mention that Blue Ridge is the Community Services Board. That's an entity created under the Code of Virginia and serves City of Roanoke, City of Salem, Roanoke County, Botetourt County, and Craig County. And our priorities for the populations that we serve by state code are people, adults with serious mental illness, and children that are either at risk or experiencing serious emotional disturbance, people with substance use disorders, and adults and children with developmental disabilities. Probably our largest volume of services is in our outpatient services. We run multiple intensive outpatient groups for substance use disorders. In fact, we have had to add an additional one during this time frame due to demand. And we know from some of the national literature and polls that are taking place that there's a good percentage of people that are responding that they are using substances more due to the isolation or kind of the challenges with the anxiety of COVID. So those services for both substance use, for adults and children, for outpatient therapy, and for mental health are open. And you can access those by calling to start there or coming to our Burrell Center. We're going to talk in a minute about some of the safety features that we have instituted on site that we'll review as well. We also provide a wide variety of other services, including case management for both mental health and developmental disabilities, our Project Link for pregnant women and women with young children that are experiencing substance use disorders actually has some space available right now for anybody that might be interested in that. We also offer psychosocial rehabilitation, mental health skill building, psychiatric services, and primary care screening. Primary care screening, that's for people that are actually come on site. We continue to operate our crisis stabilization unit, which was a 16-bed crisis stabilization and detox unit over on Hollins Road. We have, because the beds are set up 2 to a room, we've reduced those to 1 client per room to ensure kind of safety and reduce spread if there were to be any cases there. We continue to offer a number of trainings like Revive training for people who may have a loved one with opioid use disorder, and those can be found on our calendar on our website. I will say, just in terms of what we're seeing, we are seeing fewer new clients at our access, either telephonically or online or in person. And so that worries us that maybe people are not reaching out when they need services or are afraid to come out. So we want to get the word out that we are open. They can call us and we can figure out how to assist them. Our emergency services staff that does crisis pre-screenings for hospitalizations, their experience is they've seen about a 25% decrease. We also wonder if people are worried about that as well. So we hope that people are not delaying services too long. We know that both mental health and substance use disorders are treated much more effectively the earlier that they are caught and started treatment with. So we hope that this will get a little bit of that word out today. What is up on the screen now is a screenshot of our website. That button, COVID-19 resources, is one that we've added, and that has some other resources if you're not ready to engage in services, such as links to online AANA meetings, just some articles of general interest about how to cope with the stress and anxiety during the pandemic, as well as some links to some national resources, such as the suicide prevention hotline. Next slide, please. So these are some of the safety precautions that we've instituted. This is at our Burrell Center, but also the other sites that remain open, which include our Franklin Road building, which is our new children's site. So we are encouraging both clients and staff, anybody who feels sick, to stay home, just like just like everybody else is recommending. If you're in need of services and you've had a fever in the last 24 hours or other symptoms, we ask that you call first and we'll try to meet your needs telephonically. And we can also refer you to resources if you need to try to get hooked up into primary care. If you're coming to your buildings, if you have one, we ask that you please wear a mask while inside our buildings. Of course, we ask that you reserve the official PPE N95s for medical staff, but if you have a cloth mask or a disposable paper mask, please bring that with you and wear it. We are already practicing 6-foot physical distancing in all of our buildings with clients and staff, except in those cases where a nurse needs to give an injection, and in that case, everybody will have a mask on. One of the lessons learned in that 6-foot physical distancing that we found is, like, a lot of people don't know what 6-foot physical distance is. And so we've kind of reminded folks that it's about the width of a car or the length of a regular bed, and it's not quite as close as some people think it is. We are also screening at the front door of all of our buildings. We're asking health screening questions about COVID-19 symptoms, and we're taking temperatures. For our staff, we ask them to take their temperatures and self-screen for symptoms daily before reporting to work, and if they have those, we ask them to stay home and contact their supervisor. So we hope that kind of reviewing these, people will know that we've done as much as we can to try to make access to our services as safe as possible, and also to let people know that online and telephone options are available, not right now at least, as long as the federal and state regulatory bodies allow us to do that. Next slide, please. This is fortuitous, and I don't know, maybe you all knew this, but what a perfect time to start talking about resiliency. So May 3 through 9 is Resilience Week as part of Mental Health Awareness Month. Tomorrow is Children's Mental Health Awareness Day. And all of the Blue Ridge prevention staff are aware of this and promoting messages. And they have created through the Roanoke Prevention Alliance a link to resilientroanoke.org, where you can find more information about reducing the exposure to and impact of trauma, especially for children, teenagers, and families. They have a calendar of resiliency reminders, and just for your information, today's is be kind to others and yourself. So we know that the anxiety of the COVID-19 can create for some people irritability and impatience. And so I think one of the good things that we can take from resiliency is understanding that everybody's going through a tough time and try to extend kindness to each other. Next slide, please. So the other information I wanted to highlight from our prevention staff, which is, it's always hard to sort through because they have a lot of great information on their websites, is suicide prevention resources. So in times of national disasters, it is pretty typical. We have not seen that yet here, but, and of course the pandemic is a whole new ballgame for anything that any of us have seen in our lifetimes. But for most disasters, we would expect to see some increased both anxiety and depression in the aftermath, as well as potentially suicides and overdoses. So also to get the word out that help is available. Our CSB, Blue Ridge Behavioral Healthcare, along with several other CSBs in Region 3 East is what we call it. It's from us to Danville down through New River Valley, created this collaborative website, askingsaves.org, where you can find lots of information about suicide prevention. And then also locally, Blue Ridge convenes and participates in the Suicide Prevention Council of the Roanoke Valley, and you can find resources about that on Facebook at SPCRV. And next slide, please. So that's really my main message, is that we're open, we're available, and we certainly have learned a lot of lessons staying open through this. I can't say enough about the terrific Blue Ridge staff that have responded bravely and courageously and sensitively to our clients' needs. That goes all the way from our IT staff getting us online and working through those issues, as well as our maintenance staff who have learned all kinds of new ways to put up plexiglass shields for reception staff and folks like that. So, so I'm very happy that you gave me this opportunity. I'm happy to answer any questions, and thanks again.
Thanks, Debbie. So this is the time during this process that we open it up for questions of any of our media folks that have joined us. So if you will type in your questions, then we will get started at directing those to the right individuals and trying to do our part in answering those to the extent that we're able. And this is always also the awkward part where I say that and then we wait because no one has any questions yet. So hopefully we'll get some questions here as we await those. Yeah, I said it was awkward.
I know, right? Our reporter friends. There we go. All right, Mayor Lee, Vice Mayor Cobb, and City Manager Cowell, who are the individuals who council members will be meeting with virtually, and can people contact members about part of the discussion? And then who will be on the Economic Advisory Panel?
Yeah, it's funny that you asked that question because Vice Mayor Cobb had asked that question of me just as we were getting ready to start this This stuff is, everything we've mentioned is still very fresh, as in we are still in the process of finalizing the details. What we right now are envisioning with those conversations are actually taking place in two ways. One is a fairly small focus group representing a particular segment of the community. So for example, there'll be a focus group around nonprofits, there may be a focus group around small businesses and so on. And we will be working with the assigned council member in compiling that list of who they would like to have participate in that conversation. That will be supplemented with one-on-one phone conversations that the council members, or email, or whatever their choice is, with individuals. I would say at this point, if there is an interest in someone wanting to have that opportunity to actually work through Tiffany's office, through our community engagement office, and getting that information to us, we're going to begin those conversations ideally sometime next week, because we want to be able to report the findings of that in one of our June council meetings. The Economic Advisory Panel, as we've mentioned, is a collaboration with the Roanoke Regional Partnership. And so we actually asked the Roanoke Regional Partnership, who is our economic development agency here in the entire region. We gave them some criteria that we were looking for. We're looking for folks out of our key sectors. So think of things like hospitality, lodging, restaurants, those types of things. And we asked them to identify one or two individuals that they would assemble on that panel. And so they have done that for us. And so that panel will actually be assembling later this week, actually. That group, let me explain a little bit of what that group will be doing. Unlike the task force that was mentioned, that particular group will be a part of us just being able to check in with folks that represent our local economic sectors to see how things are going here locally. We'll all be able to find information from those national and state level kind of studies, and those are valuable, but we really want to know what's going on here locally, and that's going to assist the council also as they implement the FY21 budget as we go forward. There'll be more information about that panel coming out as we're just now standing up that panel as we move along, so there'll be more information coming as we go through that as well.
All right, next, can you run through the timeline again for the greenways and parking areas?
Sure, I'll start that and then see if there are any other items. So assuming that the governor continues with what he has indicated, which is on the 15th, he will begin authorizing what he's referred to as phase one. And if you recall in our earlier statement regarding the extension of the closures of the greenway, we said when that point was reached, we would likewise initiate our phased reopening of the greenways. And some of this phasing comes from some of the conversations and some of the comments made by folks either via email or at the council meetings. And so we've taken some of those ideas and incorporated that into how we're going to unroll this. So again, assuming we enter phase one with the governor on May 15th, what we will do is open the Lick Run, Tinker Creek, and Garden City greenways. That will exclude the associated parking areas. We will continue to keep those closed in an effort to try to limit the amount of the numbers of folks that actually travel to the greenways versus being able to access those from adjacent neighborhoods. So that will be on the 15th. On the 19th, then we will reopen the Roanoke River Greenway, and likewise those parking areas that are associated with it will remain closed. A little bit different with the Roanoke River Greenway, that will be accompanied by a temporary closure of the entirety of Wiley Drive through Smith Park, as well as all the way from Franklin to Crystal Springs. And that will, the reason for that is to allow more room for those folks that are in that area to be able to practice that physical distancing that we have mentioned as well.
All right, next question regarding the recovery fund. Who will be eligible for the money and how will they be allowed to use it?
Sure. As the mayor mentioned in his statements, the recovery fund is actually a combination of funding sources. So that includes some of the CDBG COVID funds that we received, and some of those dollars are specifically targeted at certain things. We actually have an RFP out right now for a piece of that funding, so that social service agencies that are interested in applying for those should visit our website. And that's a segment of the dollars that were made available, and that is for recovery efforts associated with that kind of social services side. There is also some funding that we'll be setting aside for the extension of our microloan program that the mayor mentioned in his comments earlier. And then there will be other uses that was mentioned, that the task force, which will be established in June, will be involved in helping us figure out the best way to utilize those dollars. So still very much a work in progress, because we want that task force to be involved in some aspect of making those recommendations to council.
All right. Next one, the governor says once phase 1 begins, localities can add or continue their own restrictions. Will the city have any additional restrictions in place other than what the governor requires?
I'll start and then ask the mayor and vice mayor to join in. At this point, the only additional requirement or restriction that I foresee as we enter into phase 1 that's unique to our community is that we will not be opening municipal facilities yet at that time, other than the greenways. As mentioned, we will, part of this recovery effort is an effort to define the safest way for us to reopen our municipal facilities to the general public. And I would expect that will likely occur when we enter into what the governor has defined as phase 2, which right now we would anticipate occurring somewhere in early to mid-June. So that's the one kind of local specific restriction that I'm aware of at this point. Mayor or vice mayor, I don't know if there are any other items that you're aware of or any other thoughts that we've had that would go beyond anything that the governor has indicated.
Mayor, you need to unmute. Sorry about that.
I got it.
Maybe we do if it will work.
Yeah, I think we're here.
There you go.
Can you hear me now?
Yeah.
Well, I think we want to make sure as we go through phase 1 that we're doing the things that we need to. And I'm sure many citizens and I'll be pleased to see us as we go through the process of recovery and opening up the city. I want to just emphasize that we'll want to make sure that we do things the right way. And I'm pleased that we'll have good community engagement. We're letting our citizens help us in terms of our recovery as we start out in phase 1, and it's evolving. Let's see how we do as we get to phase, when we do get to phase 2. But I just want to emphasize, make sure we understand that that's not saying we're putting healthcare on the back burner, but we want to make sure as we go through the recovery process that we hear from everybody. So I think we've got this is some challenging things, but I'm so pleased with the engagement of the community that'll be part of this.
Yeah, just to add to what the mayor said, I think that we just want to remind everyone that reopening does not mean everything resumes to normal like it was before. These kind of restrictions that we're trying to honor locally are important for a number of reasons: physical distancing, wearing face coverings, finding ways to honor that space between us. Part of the tension we're living in as well is that we still are very low in terms of a state on our testing levels and our contact tracing. So to the degree that we can continue to honor physical distancing, we will continue to flatten that curve and to make sure that our hospitalizations are down, that our cases are down, but hopefully we'll begin to see an increase in testing in the area. So just to remind everybody, it's a balance of those things as we move forward, and that every precaution we can take to honor that space between us is really critical.
Debbie, I had a question for you. Before we got started, you and I were talking about kind of these, if you will, these kind of waves really of anxiety that change as we go through this process, that there are some individuals that are experiencing that just because they have to be physically separate from others that they might not normally be. But then there are those that are working on kind of the front lines, if you will, that are really right right in the midst of this right now, that presumably as things begin to release, that maybe some anxiety that they haven't been able to actually experience, if you will manifest itself. And then I would expect as well that there's going to be a whole nother level of anxiety as we actually reopen, as people continue to see more people out and about, while those numbers that the mayor referred to continue to increase. And so can you talk a little bit about maybe what you all are seeing in terms of you said that the caseload is down. Are you anticipating that caseload to increase as those waves kind of come forward?
Well, so we probably would if this behaves like other disasters. We would likely see an increase in certainly depression and anxiety disorders and potential suicidality. A lot of our clients, just like what you guys are hearing, is there are people that are concerned about losing their jobs, getting signed up for unemployment. And that goes back to Maslow's hierarchy of needs, right? So those survival, baseline, food, shelter, safety are first in people's minds and should be. But in terms of the traumatic experiences, I was reading an interesting article the other day by somebody who had responded, say, to the Oklahoma City bombing and some other disasters. And he talked about that there's concentric circles really of trauma that you'll deal with. And of course, the frontline workers, we think about the nurses and doctors and all those kind of right there in the nursing homes, are really the frontline workers probably experiencing the most trauma right now. But as you go out from there, we also, and there's also first responders, the EMTs and the law enforcement and all those folks. But when you go out from there, you're going to see it with multiple waves of other folks. And that is people that are separated and isolated or have lost their jobs. So they have a whole nother realm of mourning and things to do. And one of the things I had mentioned earlier, it goes all the way to like city governments and those types of folks that are trying to lead folks through these times. But that really you can't just think of an upward straight up recovery and resiliency, that it's probably more likely going to be kind of waves of those kinds of tasks that go on. And, and everybody will be trying to recover from the normal anxious feelings that they're going through right now as well. And you think about bringing people back into the workplace that have been isolated at home, they're going to be anxious about coming back to work. So we do expect to see some increases, but it's such an unusual and unprecedented situation. That's an overused word, I know, that we don't quite know how we'll experience that either. So we just hope that people will reach out for help as they need it.
Great, thank you. And I should mention as well, I know we have focused obviously on mental health, of course, and that aspect of resiliency, as well as economic and those types of things, but also make sure that anyone that's actually watching this to know that we also have in this community a lot of other resources for anyone that finds themselves, for example, in a relationship that's actually turned violent, or any of those kinds of activities, that really they should feel free to avail themselves of any of those kinds of services, because that likewise is an aspect of, again, strengthening the resiliency of those individuals in the community. And I am confident that if someone contacted any one of our agencies with those concerns, we would connect them to the right resources associated with that also. Thank you, Debbie.
Yes,
thank you. Any other questions?
No, we had a few things, but just the municipal building is still remaining closed at this time. And then parks are still open.
Yeah, the parks have always been, have remained open. In Roanoke County and Salem, they took a different approach in closing some of their parks and some of their court facilities and so on. Ours have remained open and have been largely well used by individuals, meaning they have honored those requirements of limiting their gatherings and physical separations. And so we have not had to take steps to close those. I will mention, as the mayor had indicated, as we progress towards certainly the 15th, but even beyond that, and we look at the opening of municipal facilities, obviously communication is going to be a key part of this. communicating to the citizens when those services will begin to be available again and under what circumstances, but also to our employees and making sure that they understand the steps we're taking as well to be able to bring them back into the buildings. Most of our employees, or many of our employees in some of our buildings, are actually currently teleworking, except for those that are unable to do so as we go through. So that'll be a part of what we do as well. Mayor, Vice Mayor, any last thoughts or comments? And then I'm going to ask at the end, as Tiffany kind of wraps up what she normally does, if she's able to, if we can put that contact slide up for Blue Ridge Behavioral as well, for individuals that are looking for that information. So, Mayor, Vice Mayor, any last thoughts?
Well, I just want to emphasize something that the Vice Mayor said, is that we're just not opening the door and just disregarding the things that have gone. We're still in a pandemic, but I am proud as I think about Roanoke, Star City Strong, and our response to this pandemic, our recovery as we go through that process, and the people we're bringing on that will be involved with it, and the resilience. And I commend our citizens, and there have been some tough moments, and we still got a lot of work to do. But thank you for staying with us. And I think the numbers have gone down because we've had citizens who made an effort to follow all the guidelines with regards to social distancing and the non-gathering of no more than 10 people. We've done a good job. We got a work to do. Let's keep it up. Let's keep it up. Thank you.
Thank you, Mayor. Vice Mayor?
Yes, I agree with the mayor, and would just reiterate how happy we are in terms of how our city has responded to this pandemic. We really appreciate how so many people have stepped up. All of our healthcare workers, our transit drivers, our school officials, our restaurants, our small businesses. Everyone has had to be creative and resilient, and you've modeled it in a really powerful way. And I guess as my closing statement, I would just remind everyone what Dr. Molly Odell, who's our acting director of the Roanoke City and Allegheny Health District, said yesterday in her briefing, that the pandemic like this isn't over anywhere until it's over everywhere, which means the part we play in Roanoke is connected to the part that everyone plays in Virginia, in the United States, around the world. It really shows our interconnectedness and interdependence. And to tie in with what Debbie said so beautifully earlier, do not be afraid to ask for help. If you feel like you need help, call someone, reach out to someone, make that contact. Because as the website address says, asking saves. It really does make a difference, and we are here for each other. So thank you to everyone who's doing such a great job of making a difference.
Thank you, Vice Mayor. I did want to mention, as Tiffany's putting that information up, we do have the documents that we referred to as far as the Star City Strong, the recovery plan that was mentioned and talked about is on our website, and Tiffany has provided that information on what you have. You can also just go to our regular website under the COVID section and be able to link to it as well. Thank you again, Mayor, Vice Mayor, and Debbie as well. The information, of course, is on the screen for folks that are needing to access the information and the assistance. Certainly encourage folks to do so, and appreciate you being able to join us today.
Thank you.
Thank you.
It's been my pleasure. I appreciate the opportunity.
And thank you, Mr. Thomas, for being our ASL interpreter. We appreciate you.
Yeah.
Bye-bye, everyone.
Thank you all.
Thank you, everybody. Thank you.